Hello, my name is Milena Martinez, and today I'm going to be discussing with you my IRB proposal. So over the past 7 weeks, I've been doing my research mainly on the macronutrient fat, most specifically unsaturated, poly, and monounsaturated fat, and its fat-fighting properties against AD. So AD is a brain disorder which deteriorates memory, thinking, and ability to carry out everyday function. It is the 6th leading cause of death in the United States and the 3rd leading cause of death in Orange County. AD is a form of dementia, so it represents 60 to 80% of cases and is diagnosed mainly in older adults who have lost cognitive functioning. Treating and caring for individuals with AD is more expensive than cancer and heart disease, costing the healthcare system $259 billion yearly. Prior research has determined that fat can increase or decrease an individual's likelihood of acquiring AD, which has inspired the proposed research study. The macronutrient fat is a source of energy for the body. It helps with the absorption of fat-soluble vitamins and aids in the development of cell walls. Fats are categorized as unsaturated, saturated, polyunsaturated, and monounsaturated. Saturated fatty acids are found in foods such as meat, dairy, and baked goods. A high intake of saturated fat has been associated with cardiovascular disease, cancer, diabetes, obesity, and Alzheimer's disease. In comparison, diets that are high in unsaturated fat are protective against AD. Polyunsaturated and monounsaturated fats found in avocados, flaxseed, chia, fish, meat, nuts, olives, peanuts, and canola oils are all considered good fats. So research has found plaques develop in the brain caused by the buildup and clumping of the protein amyloid beta. Amyloid plaques initiate neurodegeneration in the brain related to the onset and progression of AD. Through the consumption of fat and cholesterol in the diet, neurotic plaques form, which cause the inflammation and oxidative stress to occur in the blood-brain barrier. The blood-brain barrier serves as a source of protection for the brain. An increasing amount of the amyloid beta plaques creates dysfunction of the blood-brain barrier. Cholesterol, which is a form of fat, is a key component of neurotic plaques associated with AD. Studies have found that high cholesterol consumption levels in patients midlife increases the risk of attaining dementia in late life in comparison to those with normal lipid profile scores. So because fatty acid consumption primarily affects individuals' blood cholesterol levels, the types of fat an individual consumes can impact their chance of developing AD. So income, age, and diet are all influential factors which can impact an individual's chance of developing AD. So the lack of research developed to address the issue of income, unsaturated fats, and older age in relation to AD supports the rationale of the research design. Developing a nutrition program that provides older adults with education surrounding healthy fats will aid in combating AD. So the target population and rationale. So the target population is a low socioeconomic status older adults between the ages of 55 to 65 living in Orange County, California with CalFresh Assistance. So CalFresh Assistance is the state of California's food stamp program. Low SES adults typically lack the means and access to purchase healthier food items. So therefore, they're buying and consuming unhealthy foods that are impacting the risk of AD. In 2014, 1 in 10 Medicare beneficiaries in Orange County was treated for AD or dementia, which is higher than the state or nation. So the study is established upon the hypothesis that a nutrition education program with a focus on the consumption of good fats, so poly and monounsaturated fats, will help low SES older adults maintain cognitive functioning, in turn lessening the risk of acquiring AD. The intervention will be implemented over a 5-month period, and follow-up testing will be completed 2 years post-intervention. So there's no exact time frame as far as like the development of AD when it will progress. Although it can take years for a diagnosis to even be determined. So despite this, impaired cognition is still considered a stage associated with the progression of Alzheimer's disease. The time frame for the intervention was based on prior nutrition education studies, and additionally the time frame allows for participants to develop self-efficacy and enhance healthier eating behaviors into their daily lives while testing for AD and cognitive functioning. So goals of the study include implementing, designing, and planning a nutrition education program in coordination with local Orange County nonprofits that aid individuals in obtaining food security. Second, the study's nutrition education program will increase individuals' individuals' general knowledge of good and bad fats. Third, the study will maintain baseline cognitive functioning of participants' pre, post, and follow-up intervention. Objectives of the study will be overseen throughout exclusively at baseline, post-intervention, and follow-up. The first objective will measure the effect of the nutrition education program through the FFQ, so Food Frequency Questionnaire. Second, the study will measure cognitive and verbal memory skills through the Ascertained Dementia 8-item informant questionnaire. Third, the intervention will decrease participants' likelihood of acquiring AD through education surrounding the consumption of good fats and healthy foods. Lastly, the study will analyze the impact of the nutrition education program focus surrounding good fats and its ability to deter the occurrence of AD. Areas of the study include social isolation, transportation, or scheduling issues, which can impact the goals and objectives, despite the fact the potential benefits of the participants and the community stand to gain from this research outweigh possible impediments. So the investigative team will recruit males and females between the ages of 55 to 65 years. AD is typically diagnosed in the late 60s, so the age of 55 between 55 and 65 is a range where prevention strategies can be successfully implemented. Research staff will seek the help of local nonprofits, which provide food security assistance and food stamp enrollment to locate qualified participants. Additionally, flyer advertisements will be posted at local nonprofits to recruit potential participants. Screening methods include age, CalFresh, eligibility, and the completion of the AD8. Individuals who are not currently taking medication for other health ailments will be invited to take the AD8. And subjects must have a normal cognition result to participate in the study. And the reason for that is because this is a study that's going to focus more on the prevention abilities that unsaturated fat has in relation to AD. So 80 participants will be recruited and split into two groups, the intervention and the control group. So both groups will complete the AD8 and FFQ pre and post tests. The intervention group will participate in the 5-month nutrition education program, while the control group will receive no intervention technique. Follow-up testing will take place 2 years following the intervention to measure cognitive functioning and the FFQ. So to avoid attrition and to create an incentive, all participants will be rewarded with a $100 gift card at follow-up for a local market, so that they are encouraged to come back. And it is important to note that the time span for the follow-up is also dependent upon funding. So a longitudinal study is definitely needed to evaluate the sustainability of the outcomes more so. So the ADA is a test that consists of 8 questions regarding memory and daily cognitive abilities. The final score is determined by the sum of the questions answered yes. 0 to 1 point equates to normal functioning, while 2 or greater indicates cognitive functioning is likely impaired. The FFQ is going to be a 100 food items questionnaire, which will have a concentration on foods with saturated and unsaturated fats, with a portion size per each food item, which will be specified. Nutrient scores will be calculated by multiplying the frequency of consumption of each food item by the nutrient content of the portion size. Information from the USDA food consumption tables will be utilized to determine the nutrient content. The intervention will be conducted over a 5-month period at 2 local Orange County nonprofits. The availability of the program at different sites will improve subjects' participation and access. The Master of Science in Nutrition students will facilitate the classes. They're going to be in between a 30 and 45-minute block. There are going to be 2 sessions each month over that 5-month span. The discussion of poly and monounsaturated fats will be incorporated into every session. And there will be a subtopic which includes goal setting, meal planning, grocery shopping, and disease prevention in relation to the macronutrient. The second session of the month will include activity and hands-on learning with the participants to create engagement with the curriculum and self-efficacy. Participants will be provided with handouts that include recipe ideas and summary of important points at the end of every session. The qualified key personnel of the research team and the principal investigator will obtain initial consent forms prior to the invention and 2 years later when follow-up testing is conducted. Go back here. The research team will describe the premise of the study and obtain all consent forms prior to initiating any research procedures. Individuals will be informed that they can withdraw from the study without questioning, and participation is voluntary. And all data will be maintained, collected, stored, transmitted, and shared only by the principal investigator. Additionally, the investigative staff will receive training regarding the importance of safeguarding participants' PII. All identifiable information will become anonymous through the random number function in Excel for confidentiality purposes. The study will employ a pre-post-test experimental control group design. The randomization utilized in the study will control for outside co-founders and uphold the variability and reliability of the study. In addition, the experimental design is the most esteemed. The data comprised from the AD8 and FFQ will be recorded in Excel spreadsheets and analyzed quantitatively. Data will be collected and analyzed pre-post-test and 2 years after the invention has been completed to see if participants have normal cognitive functioning or impaired cognitive functioning. It is essential to follow up with participants after the study to determine the intervention impact and if participants' risk of AD was lessened or increased. G-parallel analysis was utilized to determine the sample size of 54. The study will recruit 80 participants to account for unforeseen circumstances, including attrition or withdrawal from the study on behalf of the subjects. Additionally, a small sample size will benefit the study at follow-up when participants are contacted for testing. A dependent two-tailed test will be applied to assess the mean scores of participants pre- and post-intervention. G-Power will also render results of statistical significance of cognitive functioning and FFQ scores. The data comprised from the AD8 and FFQ pre- and post-test and at follow-up will allow the investigative staff to determine if the hypothesis can be accepted. So the proposed research study is unlike any other conducted. Therefore, the results may vary in comparison to other AD, unsaturated fat, and nutrition education interventions. The Eat Smart Live Strong study analyzed the impact of a nutrition intervention with an older adult population. They were able to increase subject food consumption by 0.35 cups and vegetables by 0.37 cups. Other studies have evaluated adult diets in relation to dementia, finding those who adhere to a healthy diet decrease their risk for AD by 90 to 92%. So both studies had similar designs and used nutrition as an intervention strategy. It is the hope of the investigative team to produce statistically significant findings through the consumption of good fats and its fighting property against AD. The research has determined that good fats can lessen the impact of AD. Therefore, implementing feasible prevention strategies for low SES older adults are vital. Focusing on prevention through nutrition education and the consumption of good fats is a reasonable solution for decreasing costs, deaths, and the development of AD in the older adult SES population. Nutrition education intervention can influence behavioral change while promoting healthy eating habits and empowering individuals. The effectiveness of the nutrition education program may call for policy to implement large-scale change. Policy can make grants more readily available for nonprofits or state programs that assist food insecure older adults. All in all, the proposed research design can impact communities such as Orange County in lessening AD through nutrition education and good fats to improve the quality of life of low SES older adults. Thank you.